So today my topic is NT-scan with double marker testing. So let's understand this in three main questionnaires. So the first thing is who should get this test done, and second, when it should be done, and third is why they should undergo this testing. So the first question, who should get this NT double marker testing done? Everybody, all the pregnant women undergoing pregnancy should get this test done. And when it has to be done? It has to be done between 11 weeks to 13 weeks of gestational age, or 11 weeks or 13 weeks of pregnancy. And why this NT double marker testing has to be done? To rule out certain abnormalities in the fetus or in the baby. Certain anomalies or abnormalities of this baby can be identified by doing this test between 11 weeks to 13 weeks. So what are these abnormalities? Abnormalities, like there are many abnormalities in the pregnancy that could happen to the baby, and I think all the 100% of it also cannot be detected, whether we do it through the scan or through blood tests. So 100% abnormalities cannot be detected, but still with this test, at least to a certain extent, we get to know. So what is that? There are some chromosomal abnormalities in the pregnancy which can occur. So what is this chromosomal abnormality? So there are like this certain set of chromosomes in our human body. So whenever there is, so there are all pairs of chromosomes, which you can see, like there are pairs of chromosomes in the body. So what do you understand by this chromosomal abnormalities? If any of these pairs will have certain mutations or changes, or any abnormal extra chromosome or minus, or if there is an absence of any chromosome, then this leads to chromosomal abnormalities. So in that particularly, we see for the 13th number of chromosomes out of all that, and the 18th number of chromosome, and the 21st number of the chromosomes. So these three chromosomal abnormality can be detected through this NT double marker scannings. So the 21st chromosome, if there is any abnormality, it's called as Down syndrome, and then there's Edwards and Patayo syndrome. There are again the medical terminologies which will actually depict these chromosomal abnormalities. So by doing this NT double marker, again 94 to 95% of the times these tests turn out to be positive for screening, that is screened positive for this means. So here there is a glitch which a pregnant woman or the couple has to understand. So these are not the confirmatory test. So this test will tell that this couple might have a chance of getting these abnormalities if any of these NT double marker tests shows abnormalities. So first we'll understand what is this NT scan or double marker. So there are two tests which are going to do. One is a blood test and another is an ultrasonography. So ultrasonography is called as an NT scan. It's again done by the professionals and specialized in this. And second is the double marker. Double marker is nothing but the blood test, wherein certain proteins are checked from the maternal blood. So blood test is done to the mother, and in that we are going to check the two proteins. Whereas the scan is also done to see the condition of the baby. So what we see in this NT scan, we see a NT means it is nasal translucency. So what do we understand by this? So we see the fluid, now amount of fluid which is present in the back of the neck of the baby, or the nape of the neck of the baby. So this is measured, and there is certain range for it, like from 0.8 to 2.3 mm it's considered as normal. So that millimeter, that measurement is being checked through the ultrasonography, and at the same time we see whether the nasal bone is present, and we also see whether the brain has developed. There are certain signs in the ultrasonography. So that whole thing includes the NT scan. The double marker, as I told already, wherein we draw the maternal blood to check two proteins in it, the measurement of those proteins. So all together, then a combined report is given for this, like the report of the scan that we do for the baby and the maternal blood test that we take. So both together a combined report is given. That is why we called it as NT scan double marker test. So when we combine both the values and the parameters, accordingly we give she screened negative for chromosome 13, she screened negative for chromosome 18, she screened negative for chromosome number 21. So accordingly we tell that that couple, I mean that lady, she is screened negative, means the chances of her having these abnormalities is at a lower risk. And it doesn't mean that she might never have it, but she is at a lower risk. That is why this reporting is done in the form of ratio, 1:1000, 1:10,000, or again the next number. So what do you understand by this ratio? It means that if we are screening around 1000 people, so the risk of getting this pregnancy is 1 in 1000, or the risk, if we are screening for 10,000 people, then the risk of getting pregnancy is 1 in 10,000 people. So more the number, the ratio, she is screened negative. If it comes to 1:1000 or less than that, then she is screened positive for this, which means that she has higher chance of getting these abnormalities in the baby. That means the baby has higher chances of getting these abnormalities. So she will be screened positive. If she is screened negative, that means the chances of getting these abnormalities is simply low or very low. So now the question is, if the screening is or the report or the result has come as screen negative. So screen negative means she has no chances of getting, so further testing is not really required. Later on, again at the 5th month, there are other anomaly scans that has to be done to further follow up of the pregnancy, routinely as we do for others. But if it turns out to be positive, then what to be done? So then if it turns out to be positive, there are again additional tests for this to confirm the diagnosis. So what do? We do amniocentesis, that is chorioamniocentesis, or CVS, chorionic villus sampling, or nowadays there is an NIPT which has come up, or quadruple marker test. There are multiple testings for that. So then again your doctor will advise you and suggest you what to be done for the if it is screened positive. And there also, if it again comes out to be a confirmed positive, then it is better to end the pregnancy or simply abort the pregnancy. So if it is screen negative, then it has to be just continued normally. So it's always wiser to get this test done, because the range also is a very short period, between 11 to 13 weeks only we can do this testing. Later on, why we cannot do the testing? Because the baby grows, then this fluid cannot be measured properly, or you will get the error results, or you will get the abnormal parameters even if there is no abnormality. So I suggest every pregnant woman to undergo this NT double marker testing, and if she doesn't understand any of this, please ask your doctor, and then she would happily tell you or explain you why it has to be done.